I'm Dean Whiting, the CEO of Pathology Technology Australia. We're the peak body that represents the manufacturers and suppliers of more than 95% of all of the tests and technology used in our pathology labs, both commercial and public, in hospitals, in primary care, and increasingly, I think in the future, in self-care as well. And I think the key priority that we have right at the moment, and probably for the next 3 years, is to address the topic of Australia really falling behind in the adoption of some really useful technology in the pathology space. We're up to 20 years behind in some areas of adoption. And the evidence is mounting now that the strategic adoption of funded testing technology in Australia could save us billions, that's with a capital B, in healthcare costs, lead to better patient outcomes, keep people out of the emergency departments. So our focus is firmly on how do we get more of this technology into the hands of healthcare professionals to benefit Australian patients and to lower overall costs. Australia is blessed with one of the best pathology services in the world. Both our commercial and our public health pathologies are some of the highest quality you'll find anywhere. But we are falling behind the rest of the world in a couple of key areas. The first is in the rollout of point of care testing, which has been used robustly in many countries around the world for maybe 20 years, but hardly at all in Australia. And this is important because of the geography of Australia and the distribution of population. And point of care testing means that the test can be done very close to the patient almost anywhere. So for rural and remote Australians who sometimes wait days or weeks to get access to healthcare, this can make a very big difference. The second area, we're probably about 10 years behind the rest of the world now in the adoption of some genomic testing. So the genomic testing is the PCR and the sequencing testing you heard a lot about during COVID. Now, this has a much broader application than contagions and infections across into cancer, into targeted therapies. And we really need to now, I think, address these gaps to catch up with the rest of the world and put Australia back into the top 2 or 3 position in healthcare in the world. So it's a complex question to address as to how other parts of the healthcare system can address some of these issues. And in some ways, really, it's a catch-22 situation. Australia has a almost 100% funded pathology sector. So it's almost 100% taxpayer funded, either through Commonwealth MBS or through state health. And if your test isn't funded, then it's not used. If your test isn't used, it doesn't get into clinical trials and doesn't build the evidence base needed to demonstrate the value to get the funding. And if it doesn't get used, it doesn't factor into a lot of the clinical decision processes, the clinical pathways for treatments of people, and therefore it doesn't get used. So it's a kind of useless loop here that means that the tests don't get used and then they don't get used unless they're funded. So I guess in many ways, the way that we could address that is to look at different ways of introducing tests by using, say, international evidence. If we could use a large amount of the international evidence, the health economic evidence, to introduce and fund tests, that would help. If we could potentially fund tests ahead of that evidence base on a conditional basis, and then monitor over a period of time the benefit to patients and the value to the healthcare economy. Now, the evidence is mounting that the failure of putting tests onto the MBS is costing the Australian healthcare economy probably billions, with a capital B, many billions, I would think, and it's leading to less optimal outcomes for patients. So I think it's really now time to adopt that approach. And I think, starting to think about novel ways in which we can fund testing, I think is really needed. One of the byproducts of COVID and the pandemic was that people became far more aware of tests like PCR, the polymerase chain reaction, and genomic sequencing to diagnose and to track the COVID virus. And in that sense, people's awareness of pathology has increased. But to my way of thinking, there's an awfully long way to go because, in Australia, as a 100% taxpayer-funded pathology industry, And the fact that people don't really see the tube of blood once it leaves and heads off somewhere, they don't really think about the lab, they don't think about the technology, and so it's pretty much out of mind. Um, and so I think the awareness needs to be built. I think a lot of people don't understand that the pathology tests are responsible for about more than 70% of decision making in healthcare, so diagnosis and treatment, and 100% of all cancer diagnosis. You can't diagnose cancer without a pathology test. So I think there's still a long way to go here. I think if pathology tests suddenly stopped overnight, the healthcare system would be in disarray in days or weeks. We couldn't function without an operating without an operating pathology system and the technology that supports it. So yes, there's still a long way to go, but I think we're getting there slowly, and hopefully messages like this will help build that awareness. We certainly applaud Minister Butler's introduction of the Strengthening Medicare Taskforce report. There's no doubt that Australia's healthcare system, which 40 years ago was amongst the world's best, now definitely needs reform. And we agree that strong change is needed. While there is a lot of detail missing in the report, what is clear is that there's huge scope for technology to be able to help render some of this change. And technology in pathology would be up amongst that as well. So we know for sure, and the evidence is building very strongly, that the better use of technology can save money and give much better patient outcomes. And the kind of technologies that we are really prioritising over the next couple of years are the point of care technologies, where testing can be done much, much closer to the patient, and then the right remedies can be performed immediately, and genomic testing for diagnosing and treating cancers, for contagions, for targeting therapies specifically to an individual's healthcare complaint. These all have huge application in helping make our healthcare system more efficient, deliver better patient outcomes, and reducing the total cost of healthcare. The upcoming federal budget gives us an opportunity to potentially start to address some of the shortfalls in healthcare at the moment. Realistically, though, the government will be, I think, focused very, very heavily on deficit reduction. Nevertheless, that doesn't stop us from introducing the ideas that pathology testing is not necessarily a cost centre, but astutely introduced pathology tests and technology could actually be a saving, a huge saving. The evidence is mounting now that the delay in introducing funded pathology tests could be costing the healthcare economy billions of dollars and leading to much less optimal patient outcomes. So we're certainly projecting that message to the federal government. And if we're not successful in getting things up for the 2023 budget, I think we'll have a very strong stake in the ground for MyInfo and for the 2024 budget.